Welcome to Mastering Top 200 Drugs for PTCB 2026. This video focuses on generic names, brand names, and classifications of key medications to prepare you for the pharmacy technician exam. Let's review study strategy pearls for mastering drug names and classifications. Use a 3-column structure for generic name, brand name, and classification. Utilize active recall, quizzing, and spaced repetition, retiring cards only after 3 perfect recalls. Be aware of look-alike and sound-alike drug pairs, such as lamotrigine versus levetiracetam. Pay close attention to drug endings like pram and exa for classification hints. Always read the last 4 letters of generic names and note the indication hint in the question stem. We are now covering ACE inhibitors and ARBs, which are RAAS modifiers. ACE inhibitors ending in pril include lisinopril and ramipril. ARBs ending in sartan include losartan and valsartan. Remember the key warning: avoid in pregnancy. Next are beta blockers and calcium channel blockers. Beta blockers end in LOL, such as metoprolol and atenolol. CCBs include amlodipine and diltiazem. Key warnings include watching BP and HR, the grapefruit warning with CCBs, and the risk of abrupt withdrawal. Here are key diuretics and anticoagulants. Diuretics are classified as loop, thiazide, and K-sparing. Anticoagulants include warfarin and NOACs like apixaban. Remember that reversal agents are vitamin K for warfarin and andexanet alpha for NOACs. Let's review sample questions. Enalopril's brand is Vasotec. Amlodipine interacts with grapefruit. Hold metoprolol if the heart rate is less than 50 beats per minute. Spironolactone's class is a K-sparing diuretic. Antidepressant medications include SSRIs, SNRIs, and atypicals. SSRIs like sertraline take 2 to 4 weeks for effect. A key warning for all is an increased suicide risk in young adults. Avoid MAOI overlap within 14 days. Moving to neurologic medications, anti-epileptic drugs, or AEDs, include levetiracetam and lamotrigine. Parkinson's agents include levodopa-carbidopa. Remember that abrupt withdrawal of AEDs can precipitate seizures, and therapeutic levels are crucial for monitoring. Opioid analgesics, like morphine and oxycodone, are C2. Tramadol is CIV. Common side effects include respiratory depression and constipation. The reversal agent for opioid overdose is naloxone, also known as Narcan. Practice with these sample exam questions. The brand of sertraline is Zoloft. Tramadol is a CIV opioid. Naloxone is the antagonist for overdose. The onset of effect for an antidepressant is typically 2 to 4 weeks. Insulin is categorized into rapid, short, and long-acting types. Rapid-acting insulins, like insulin aspart, have an onset of about 15 minutes. Remember, only regular insulin can be administered IV. Generic names always include the term insulin. Key diabetes medications include metformin, a first-line agent, and glipizide, a sulfonylurea. Pay attention to warnings such as lactic acidosis risk with metformin and hypoglycemia risk with glipizide. Levothyroxine and liothyronine are thyroid hormones. Levothyroxine should be taken on an empty stomach. Prednisone, a corticosteroid, requires a taper schedule to avoid adrenal suppression. Do not stop these medications abruptly. Let's review more sample questions. Regular insulin is the only type for IV use. The brand of metformin is Glucophage. Levothyroxine is taken 30 minutes before breakfast. Prednisone requires a taper. Antibiotics include penicillins and cephalosporins, which are beta-lactams. Examples are amoxicillin and cefdinir. Key warnings include watching for diarrhea and potential cross-sensitivity between the 2 classes. Remember to finish the full course of medication. Macrolides include azithromycin and clarithromycin. Fluoroquinolones, like levofloxacin and ciprofloxacin, carry a black box warning for tendon rupture. A key instruction is to avoid antacids 2 hours before or after fluoroquinolone administration. Medication specifics to remember include sulfamethoxazole trimethoprim, which can cause rash and hyperkalemia. Metronidazole requires no alcohol due to a disulfiram reaction. Oseltamivir is used for influenza. Refrigerate acyclovir suspension. Test your knowledge. The generic name for Zithromax is azithromycin. Bactrim components are SMXTMP. The flagell warning is no alcohol. The risk with Cipro is tendon rupture. Acyclovir suspension requires refrigeration. Respiratory medications include rescue inhalers like albuterol and anti-inflammatory control medications like fluticasone. Patient counseling should include rinsing the mouth after using an inhaled corticosteroid to prevent thrush. We have reached the end of the content section. The following slides will contain additional information and practice material for your exam preparation. This concludes our review of the generic names, brand names, and classifications of key medications for the PTCB 2026 exam. Remember to utilize the study strategies discussed, including active recall and spaced repetition, to maximize your learning. Continue to practice recognizing drug name pairs and the suffixes that indicate their classification to avoid common exam traps. Ensure you are familiar with the key warnings and counseling points for each drug class, as these are critical for safe pharmacy practice. Revisit the sample questions in this video to gauge your understanding and identify areas needing further review. A strong grasp of the top 200 drugs' classifications, indications, and side effects is vital for success on the exam. Focus on high-yield information such as black box warnings, drug-drug interactions, and administration instructions. Consistent review and self-testing will build the necessary knowledge base and confidence for your certification exam. Thank you for watching this video. We wish you the best of luck in mastering the top 200 drugs and achieving your PTCB certification.